Bismillahirrahmanirrahim. Hello everybody. So an 18-year-old woman come to the office due to vaginal pruritus and discharge that began 5 days ago. 18-year-old. She has no fever, chill or abdominal pain. She is monogamous with her male partner and is using combination estrogen progesterone pills for contraception. Her last menstrual period was a week ago. The patient has no other medical problems and take no medication and has no drug allergies. She does not use tobacco, alcohol or illicit drug. Temperature is 36, blood pressure is 118 by 74 and pulse is 68 per minute. Pelvic examination show normal external genitalia. On speculum examination, there is a thick yellow cervical discharge is noted and the cervix easily bleed on contact with the swab. The patient has no pain or pelvic bimanual examination. The remainder of the examination is normal. Urine beta ECG is negative. Cervical swab are obtained for further testing. The patient is going out of town for 2 weeks and will be unable to follow up during their time. Which of the following is the most appropriate next step in management of this patient? Azithromycin and ceftriaxone, azithromycin only, cefoxitin and doxycycline, ceftriaxone only, delay in treatment until test result are returned, metronidazole only. So first of all, this patient having 18 years of age. First, we will go toward the diagnosis of this question. After knowing the diagnosis of this question, we will easily know that what is the treatment option for this patient. So first, the female is 18-year-old female patient, and second, she having vaginal pruritus and discharge. Third, she is sexually active. Fourth, on speculum examination, she having thick yellow discharge, cervical discharge. Fifth, cervix easily bleed with swab. So based on these 5 hints, what is the diagnosis of this question? First, the female is less than 23 year old, 23 year age, 23 year. Second, she having the vaginal pruritus and discharge. Third, she is sexually active. Fourth, on feculum examination, she having thick yellow discharge and the cervix bleed easily on swab, on contact with swab. So diagnosis of this question is cervicitis. Cervicitis is the diagnosis of this question, and the treatment option for cervicitis is azithromycin with ceftriaxone dual therapy. Why azithromycin and ceftriaxone? Because this patient has the classical presentation of acute cervicitis with mucopurulent discharge and a febrile cervix. Although nucleic acid amplification testing, which is a test recommended for cervicitis, so recommended as positive result confirm infection. Treatment can be administered empirically based on examination. Early treatment allow for symptomatic relief and decreased chance of transmission to sexual partner. A delay in treatment increases the risk of ascending infection. So first line empiric treatment for acute cervicitis is dual therapy with azithromycin plus ceftriaxone, which provide coverage against the two most common etiologies, that is chlamydia trachomatis and Neisseria gonorrhea. So here the correct option is choice A, azithromycin and ceftriaxone. Come to the incorrect one. Choice B, monotherapy with azithromycin only. So azithromycin monotherapy is the treatment of choice for nucleic acid amplification testing proven chlamydial cervicitis. So azithromycin only is for the treatment option is for the chlamydial cervicitis. Choice C, cefoxitin and doxycycline. So cefoxitin plus doxycycline provide polymicrobial coverage for pelvic inflammatory disease which present with cervical motion tenderness, that is called Chandelier sign, uterine or adnexal tenderness, none of which are present in this patient. Choice D, ceftriaxone only. So ceftriaxone monotherapy was another treatment option for nucleic acid amplification testing proven gonococcal cervicitis. Choice D, delay in the treatment. So a delay in treatment increase the risk of ascending infection, for example, pelvic inflammatory disease, and long-term sequelae, for example, ectopic pregnancy. Choice F, metronidazole only. So metronidazole is used in the treatment of bacterial vaginosis, which present with watery discharge, and trichomoniasis, which typically present with green fruity discharge. I will explain to you that why the choice A is the correct one, azithromycin and ceftriaxone, because this patient having the cervicitis because she is 18-year-old, she is sexually active, and she have vaginal pruritus with discharge. On speculum examination, she having thick yellow discharge. So here the correct option is choice A, azithromycin and ceftriaxone, because it provide it is dual therapy and provide the treatment for the second most common etiology, that is Neisseria, gonorrhea, and chlamydia trachomatis.